we've gone over the big superficial rectus spinae. We've got a layer deeper into the Quadratus Lumborum. Call it deeper again through the stomach, that's how we would treat it, but the hip flexor, the psoas in the front, have a look, that encompasses this whole spinal area. It puts huge pressure on all the structures here, especially if they're in balance, but for that you need someone to do a really good assessment. Now, the piriformis is a direct link from the legs and the sciatic nerve area up into the sacrum, so that causes a lot of strain. So we take off all the pressure of these main attachments into this area. We can talk about the transverse abdominals, the internal oblique, the external oblique. I'm actually not as interested in them. They are ones that we're not so concerned about stretching so much as strengthening. That's another video where we can talk about that, because with those, if you can get this stuff long and strong, it becomes very supportive for your spine, not just your lumbar spine, but also your thoracic and your cervical. Get this area right, get your base right, and the rest of it has a better chance of sitting in the right position. But then, when it comes to lifting, we don't want to rely just on these. We want to create a tree trunk, not just a flimsy branch, a tree trunk out of your whole torso, and that's where those other muscles are really, really important to help brace this structure. But that's something else. But go away, do those stretches. They're brilliant stretches for everything. Now, I know there's a lot of horse riders. We do stuff for equine therapies for the rider. This is brilliant for them as well. I mean, especially when you come talking about lunging horses, when you talk about carrying feed buckets, there's a dominant side there. When you talk about even the way you ride, your horse might be has a handedness. You might have a tendency to go one way or the other based on hip height or just riding technique. These stretches are brilliant for avoiding injury. Great way to recover from falls or anything like that. But this is also perfect for labourers, perfect for office people that sit down too long and their hip flexors get short in the front. All sporting people, there's basically a million different reasons why you do these stretches. These are stretches for life. I don't just tell people to go away and do these just while they're getting treatment, just while they're trying to recover. These are stretches that we should all be doing. Maybe not daily, I'm not unrealistic. I got heaps better things to do than stretch. But if you can regularly do these a little bit often over the course of weeks, months, years, you're going to prevent a hell of a lot of injuries, a hell of a lot of pain. You're going to save a lot of money, not seeing someone like myself, or your physio, your chiro, your osteo, whoever you see.